Patau syndrome is a serious rare genetic disorder caused by having an additional copies of chromosome 13 in some or all of the body cells. It also called trisomy 13. Each cell normally contains 23 pairs of chromosomes which carry the genes you inherited from your parents. It happens when the cells divide abnormally during reproduction and create extra genetic material on chromosome 13. This severely disrupts normal development and in many cases result in miscarriage, stillbirth, or the baby dying shortly after birth. Most cases of trisomy 13 are not inherited and result from the random event during the formation of egg and sperm in the healthy parents. An error in cell division called non-disjunction results in a reproduction cell with an abnormal number of chromosomes. For example, an egg or sperm cell may gain an extra copies of chromosome 13 if one of these atypical reproduction cells contribute to the genetic makeup of the child will have an extra chromosome 13 in each cell of the body. Due to the presence of several life-threatening medical problems, many infants with trisomy 13 die within their first day or week of life. Only 5% to 10% of children with this condition live past their first year. Other names for this condition has been expanded, like Patau Syndrome, complete trisomy 30 syndrome, Patau Syndrome, and trisomy 13 syndrome. Although women of any age can have a child with trisomy 13, the chance of having a child with this condition increases as a woman gets older. There are 4 types of trisomy 13, full trisomy 13, mosaic trisomy 13, partial trisomy 13, and translocation trisomy 13. The exact cause of Patau syndrome is not known. Patau appears to affect females more than male because male fetus do not survive until birth. This syndrome may affect individuals of all ethnic backgrounds.
Babies with Patau syndrome can have a wide range of health problems. Their growth in the womb is often restricted, resulting in a low birth weight, and 8 of 10 will be born with severe heart defect. There are a lot of symptoms, for example, cleft lip and palate, which is a gap in the upper lip that present from birth. The gap is there because part of the baby's face did not join properly during development in the womb. Also, they can have an abnormal small eyes called microphthalmia and anophthalmia, which is a condition of absence of one or both eyes. Another abnormalities that they can have is microcephaly, which is a condition where the head size is smaller than normal. Next, they can have ear malformations and deafness. There may also be abnormalities of the hands and feet, such as extra fingers or toes we call polydactyly, and a round bottom to the feet known as rocker bottom feet. Patau syndrome can also cause other symptoms such as abnormal cysts in the kidney, and abnormally small penis in boys and enlarged clitoris in girls. Also, they can have characteristic facial appearance along with poor muscle tone known as hypotonia.
On to the next content, which is what are the causes for Patau syndrome. Firstly, we understand that complete trisomy 13 happens when someone has a whole extra copy of chromosome number 13 in their body cells. About 90% of cases of trisomy 13 are this type. This occurs as random events during the formation of reproductive cells, where an error in cell division called non-disjunction can result in an abnormal number of chromosomes. Next, mosaic trisomy 13 is the existence of a third copy of chromosome 13 in some of the cells. About 5% of cases of trisomy are this type. Mosaic Patau syndrome is not inherited and occurs as a random error during cell division early stages of fetal development. While partial trisomy 13 is the presence of a part of the third copy of chromosome. Less than 1% of cases are this type. This happens when there is chromosome translocation, and Patau syndrome due to a translocation can be inherited. Translocation trisomy 13 occurs when the genetic material is rearranged between chromosome 13 and another chromosome. As a result, part of chromosome 13 became attached to another chromosome. As translocation can be inherited, an affected person can carry a rearrangement of genetic material between chromosome 13 and other chromosome, known as balanced translocation. Although they do not have the signs of Patau syndrome, people who carry those type of balanced translocation are at risk of having children with this condition.
Assalamualaikum, my name is Anisha Zwani. Now I would like to explain on the part of diagnosis for Patau syndrome. First test is non-invasive prenatal testing and IPT. An IPT is a non-invasive method done by 10 weeks of pregnancy. It is a screening test, so it can only estimate whether the risk of having chromosomal disorders is increased or decreased. This only requires drawing blood from maternal and does not pose any risk to the fetus. The blood test will analyze the cell-free DNA cfDNA from the placenta that circulate freely in the maternal bloodstream. These small fragments of DNA arise when the cell dies and releasing it contains nDNA into the bloodstream. To achieve a reliable result, the proportion of fetal fraction of the cell-free DNA must be above 4%. If an IPT result is high risk for a genetic abnormality, further diagnostic test is recommended. Next is ultrasound test. Ultrasound test uses sound waves to show a picture of the baby in the uterus. It can help check on the baby's health and development. Babies suspected with Patau Syndrome may show brain anomalies such as holoprosencephaly. This can enable diagnosis of Patau Syndrome as early in 12 weeks of pregnancy. Chorionic villus sampling CVS is done at 10 to 12 weeks of pregnancy. During the test, a small sample of cells chorionic villi is taken from the placenta where it attaches to the wall of the uterus. Chorionic villi can be used as a sample as it is formed from the fertilized egg, so they sharing same genes with the fetus. Depending on the position of the uterus and bladder, the patient's gestational age and placental localization, it can be performed transabdominally or transcervically. In transcervical CVS, a catheter is inserted into the placenta through the cervix by the guidance of ultrasound to take the sample. In transabdominal CVS, the needle is inserted straight into the abdomen and moved up and down through the placenta to collecting the tissue. Next diagnostic test is amniocentesis. Amniocentesis is done at 15 to 18 weeks of pregnancy to take samples of amniotic fluid. The sample is removed through a fine needle inserted into the uterus through the abdomen under ultrasound guidance. Both tissue samples of CVS and amniocentesis will be sent to the laboratory for culturing and further testing, including karyotyping and fluorescence in situ hybridization. Besides that, karyotyping can also be done to diagnose Patau syndrome. Karyotyping is the process of pairing and ordering all the chromosomes of an organism to provide a genome-wide snapshot of an individual's chromosome. A karyotype may be used to look for abnormalities in chromosome number or structure. For Patau syndrome patients, they will have 47 chromosomes due to an extra chromosome on chromosome 13. Last but not least, molecular cytogenetic technique can also be used for diagnosis. This technique localizes presence or absence of specific DNA sequence in chromosome. In Patau syndrome, FISH test is used to detect trisomy of chromosome 13. Probe that is specific to the DNA sequences on chromosome 13 is used. Then, the probe is labeled with fluorescence to assist in visualization. For examples, 3 green signals are seen in this picture showing this patient has trisomy 13, additional copy of chromosome on chromosome 13, indicated this patient suffering from a Patau syndrome.
Okay, next is management of Patau disease. There is no definitive treatment for Patau disease as it cannot be cured. The treatment is usually based on the symptom that presented by the baby. The aim is usually focused on minimizing discomfort and ensuring the baby is able to feed. The first one is surgical intervention. For infants that have cleft lip, a lip tapping regimen can be done to narrow the gap in the child cleft lip. For symptom of polydactyl, removal of extra finger can be done. For example, removal for extra little finger can use vascular clip attached to the extra digit and cut off the blood flow of it. It is similar to how the umbilical cord is clipped at birth. But if child has complex polydactyl, which is extra finger is more fully developed, more extensive surgery is done. Cardiac surgery is also performed to repair common cardiac abnormalities. Next is technological intervention. For symptom of ear malformation or deafness, patient may have hearing aids to make sound louder. Cochlear or brainstem implants is designed to replace the function of damaged sensory hair cell inside the ear to help provide clearer sound than hearing aids. And bone anchor hearing aids that placed on the side of deaf ear, transferring sound through bone conduction and stimulating the cochlea of the normal hearing ear. Last but not least for intervention is speech intervention that can help with feeding because the liquid may leak out of the baby nose. It also can help people with problem with swallowing food and drink. For treatment, there are several treatments can be done. The first one is post-delivery oxygenation and ventilation. For example, at delivery, infant with Patau disease that have facial defect will need incubation and tracheostomy. Seizure prophylaxis is to prevent seizure, which is an episode of abnormal electrical activity in the brain where a person's body may shake rapidly and uncontrollably. Prophylactic antibiotic can be used to prevent infection. Doctor will give antibiotic ahead of time to prevent infection where the risk of infection is high.
That's all from us. This is our QR code for our reference. Thank you.